Well, thank you very much for joining me for this seminar, which is going to cover how we recognize pain in cats and also a little bit about treatment and prevention of acute pain in cats. So just to get our heads around how many animals we're talking about, just let's remember that cats outnumber dogs as pets in the United States. So we're talking about over 70 million cats, and most of them are going to undergo at least one surgical procedure during their life. But a big question I ask myself every day is, are cats being adequately treated for surgical pain? And there's absolutely no doubt we have come a long way over the past decade, and certainly we have data from all around the world, for example, South Africa and Canada, showing that our treatment of pain in cats has increased over the previous years, and we are definitely getting better. But are we as good as we could be about treating pain in cats? And if we look at this data that's very, very current, this is 2004 data that was published from a group in New Zealand, and they surveyed veterinarians in Australia, United Kingdom, and New Zealand. And we can see that we are getting much better at doing pre- and intraoperative analgesia in cats. For example, elective procedures like castration and ovarian hysterectomy. But what we tend to see is that we're not as good about continuing our postoperative care, and then we almost never, looking at this data, send cats home after castration with anything, and very few cats that have been spayed go home with any continuing analgesics. But yet we do know, when we look at behavior, how animals behave after a painful procedure, then we do know that pain can continue for more than a few hours after elective procedures. For example, this paper shows that when cats return home after an ovarian hysterectomy, they can be painful for several days. So what are the reasons for undertreating feline pain? I think one of the main reasons is that we don't always look for it, and even if we're looking for it, we don't always recognize pain in cats. Another big holdback, which is being rapidly resolved, is the lack of licensed drugs, and we are now getting more and more drugs on the market that are specifically labeled for use in the cat. Difficulty with medicating cats, that's always an issue. Intravenous access, intramuscular access, or even pilling cats is always a challenge. So we're looking for easier or longer acting drugs to help us with that. And then the other big issue is the fear of adverse drug effects. And hopefully by the end of this seminar we'll have gone through all of these things, and you will feel very, very comfortable about recognizing and treating pain in cats. When we think about pain, there are three dimensions of pain. We have the physical or the sensory component, and this is very easy to measure and it's very easy to describe. It's the ouch, that hurts part of pain. But there's a very important other component to pain, which is a psychological component to pain. And we all know that, and I think we all believe that animals certainly feel this. It's the psychological effects of pain. So it's not just how it feels, but how does that pain make you feel, or how does the pain make the animal feel? And that's the more emotional component of pain that we need to think about when we're dealing with our patients every day. So for us, if we go into hospital and have a procedure, we are asked how we feel and how much we hurt. So in humans, pain is what the patient says it is, but we're dealing with a completely different population. So in animals, pain is what we decide it is, because they are trying to tell us something. We don't always recognize it, and we'll be talking about that. But we make that decision for them. So it's really, really important that we get it right so that their pain is treated. So how do we know that cats hurt after a surgery or after a traumatic event? And what we really, really want to do is promote pain as at least the fifth vital sign. We, automatically take temperature, pulse, respiration, often blood pressure, but every time we look at a cat, we should also be measuring or assessing it for pain. So developing pain scoring tools is not a straightforward and simple thing to do, and certainly I've been involved in developing some tools that we'll talk about, But when we are planning on making these tools useful in clinical practice, we have to think about certain things. The first thing is they need to be animal-centric. So the tool has to understand a functional response of the animal. For example, today we're going to talk about what do cats do when they're painful that they don't do when they feel really good and free of pain. These tools need to be anthropocentric. They have to have a human goal in mind, which is to stimulate us to reevaluate and interact and treat the pain in that cat. But they have to be very objective so that we aren't having a lot of bias and subjectivity in our pain scoring. And then they also need to be validated, and that is often the hardest part of developing these tools. Do they actually measure pain, or do they measure something else? For example, the side effects of anesthesia or the sedation from the anesthetics we are using. The objective measures is something, we're all scientists at heart, and we are always looking for something that's easy to measure that would equate to pain. And things that might change when a cat is painful are things like heart rate, respiratory rate, and blood pressure. But we all know that those things change dramatically, unrelated to pain. For example, this is an excellent study that was done by the group at Colorado, where they measured heart rate, respiratory rate, and blood pressure in cats in their own home environment, then transported them to a clinic and remeasured those parameters. And clearly the cat didn't become painful on the journey, but these parameters changed dramatically, and it was obviously due to fear and stress about being in a clinic. So objective measures are usually looked at, but on their own, they're not good indicators of pain. So the two tools that have been developed are the one by the group in Brazil. This is Dr. Brondani's work, where they've been validating and refining their tool for scoring pain after ovarian hysterectomy in cats. And that one has been published, and it's being quite widely used. It's quite it's very comprehensive, and it takes quite a while to do. It's 3 pages long. So a group at Glasgow have developed another tool, and that is a single page and quite quick to do and has been validated. And we'll be talking about some of the things that both of these tools actually look at, and there's very much good agreement between the two tools if you use them to assess cats. So the things that have come up with the two independent studies on looking at what cats do when they're painful are looking at posture, activity, their attitude, how they interact with a caregiver, reaction to wound palpation, and then there are some other miscellaneous behaviors or features that we're going to talk about and look at in cats. So when we talk about behavior, I think an easy way to think about behavior, because that is going to be the key to figuring out if a cat is painful. And I look at 3 things. Has the cat maintained normal behavior after we've done surgery? Has it lost a normal behavior, or has it developed a new behavior? And any of these things would maybe alert us to look more carefully at that cat to find out why there's been a change in behavior. In cats, I think we'll all definitely agree that differentiating fear from pain can be a challenge. These are all pain, fear, and stress. They're all aversive to cats, so we should be addressing all of these things when they are in our clinic. But certainly, I think by the end of this seminar, you will certainly be able to tell the difference between just fear and stress from pain. And we're looking at 2 pictures right now. The cat on the left has a hunched posture and its head is down. But this is a cat that hasn't actually had surgery yet. That's a fearful posture. The cat on the right, and we'll be visiting this cat again, has a hunched posture, but this is a cat that has had surgery, and this is a cat that actually is showing other signs of pain that we'll see when we show videos of that cat. So looking for normal behaviors. All of us know intuitively what cats do normally. So look for normal behaviors. And this is a picture of what most cats will do when they're aroused. They've been sleeping. When you arouse them or they arouse themselves, they get up and they do a really, really nice long stretch. So that would be a normal behavior to look for. And that behavior may well disappear if the cat has a painful abdomen. And then we're going to look at normal behaviors being maintained. So what we just watched there is a cat before surgery, and this cat is one that was one of the cats I was using in a study in the United Kingdom. So she had a flank spay, and you can see the incision on her side there. But this cat behaved exactly the same before and after the procedure, up at the front of the cage, wanting to play. So this is a very good sign that normal behavior has been maintained and she's probably comfortable, although there are other things that we would check out on her. Position in the cage can be helpful, but I think you have to put it in perspective, because some cats are going to be fearful when they arrive at the clinic and go to the back of the cage. So it's better to look at the position before and after procedures. So here is a little kitty called Tripper, and a bit of an escape artist, up at the front of the cage prior to his procedure, trying to get out. But after the procedure, and it was a major orthopedic procedure, you can see he's still at the front of the cage. He's got his paw out there, and he's still trying to interact with everybody that goes past. So again, a good sign that he stayed at the front of the cage. This is another cat that had a major orthopedic procedure, and when Speedy was feeling good, up at the front of the cage, interested in what's going on in the clinic and with people, but when pain management was not as good as it should be, you could see that he would retreat to the back of the cage and go and look for somewhere to hide. So that's a change in his normal behavior. Posture is very, very helpful, and so these are two images of normal postures in cats. The one on the left just happens to be one of my cats, and this is how a lot of cats spend, I don't know, maybe 12, 16 hours of their day, curled up and very relaxed. The cat on the right is in a clinic. He's quite attentive and alert, but he is in a normal posture. He's looking at us. He's got his front paws tucked under. So these are normal postures. So what we're going to look for are changes in these normal, comfortable postures. And one of the postures that has been very, very well correlated with abdominal pain in cats is a hunched or a tucked up posture. And there are several studies where they videotape cats the day before ovariohysterectomy and then the day of the surgery. And rarely do you see a cat adopt these postures except after abdominal surgery or if they have abdominal pain. So hunched up, elbows tucked back, head down, certainly these are things that would alert you to look at this cat and decide, what you need to do, because this is a good indicator of abdominal pain. But of course, I say that, and then a lot of people say, well, that looks like a fearful or scared cat to me. And I agree. Often a cat will go to the back of the cage, like this one, and she will hunch herself up or tuck herself up, trying to make herself disappear. And that is absolutely true. But again, if you look very carefully, or you look before and after, as we see in these next pictures, you can see that there's a difference. So on the left, this is a cat at the back of the cage, and she's fearful. But on the right, this is after a flank spay. She's tucked up. She's still at the back of the cage, but her posture has changed. And a lot of you are probably looking at her face and have seen how her facial expression has changed as well after the surgery. And we're going to talk about what that facial expression may also tell us about this cat. Scoring posture is part of the pain scores or the pain scoring tools that are available now. And this is a female cat here. She has kittens with her, but this cat has just undergone an ovariohysterectomy, and we're watching this video. She's quite hunched and she's changing posture. And so if we go to one of these tools, we have choices when we're looking at posture. Is this cat in a natural posture? Is she tense? Is she hunched? Or we have another choice, is she laying on her side with her limbs extended? So we can actually circle 2 for her score for posture here. And that's a fairly easy thing to look at, and then just you go ahead and score the cat. And let's look at this cat. So this is a cat, again, recovering from a midline ovariohysterectomy, and she's in lateral. She's quite tense. She won't put her leg down, probably because when she does, she becomes more painful. So again, if you look at the choices you have on this video, then you would circle number 3 for her posture. Response to palpation is very important. If we do good pain management, we ought to be able to palpate wounds. And this is little Tripper, who you've met before, and we are palpating where he had a bone graft taken from. And we're palpating around there, and there's no response at all to us palpating, no vocalization. So he scores a 0 for response to palpation. And then let's look at this cat, a little bit different. So we have choices, 0 to 3. And that was a cat that we were petting it, and then we went to palpate her midline abdominal incision, and she reacted just as we touched it. So again, fairly easy to circle number 2 for response to palpation there. Another thing I look at very carefully is whether the cat is grooming or paying too much attention to the wound. Because cats that are very, very comfortable should not be licking and over and over and over and paying too much attention to their wound. So sometimes you have to watch fairly carefully to see, is it just the wound they're paying attention to, or are they actually performing some personal hygiene things? And these videos are cats that are truly focused on their incision. This one's actually biting at its incision, and that would be an indicator of pain. If this incision is feeling good, they usually pretty much ignore it. And then we did mention looking at facial expressions, and this is work that has certainly been very, very interesting to me, because if you think about it, pediatricians work with a very similar population as we do as animal caregivers. They're working with a population that can't self-report and tell us how they feel. So certainly with newborn babies, they were videotaping them before, during, and after a acute stimulus. And every newborn baby has to have a blood sample taken. And the way they get that blood sample is to do a little heel stick and collect the blood from after they puncture their heel. And so you can see clearly in these two pictures, right when they apply the acute painful stimulus, the baby changes its facial expression, and this can actually all be put into a computer. You can actually measure all the different changes and do facial recognition and score pain this way in newborn babies and very young children. So can we do that in animals? And certainly the pain face in animals is getting a lot of coverage right now, and there are several species where we now have clearly shown that animals express pain through their facial expressions. So certainly there's good data in rabbits to show that they express pain through their face, and they do that by a change in the position of the ears, the whiskers, cheek bulges, and so on. And then there's also information in rodents to show that you can identify pain, acute pain, through a change in their facial expressions as well. It hasn't been fully validated in cats, but there is work going on right now to do that. And certainly I think if you look at their facial expression, you can get additional information. This is a little kitten, a 6-month-old kitten, Max, who had a degloving wound. We don't really know what happened to him, but it was a fairly extensive wound that he had. He was in our hospital for over 10 days. And on the left, this is Max when he's feeling really, really good, and his pain management is just what we want. His head is up, he's looking at us, and his eyes are open and horizontal within his face. On the right, this is not Max sedated. This is Max when he's starting to feel uncomfortable. And you can see his head comes down a little bit, and actually you can see a change in his eyes. He begins to half shut his eyes, and there are actually some changes in his whisker position. He has a little more tension in his face and pulls his whiskers back. So these may seem fairly subtle, but when you start looking for them, you can start to see these expressions in cats. And again, this is a much more dramatic contrast in Max. And so this is Max. He's actually had a major skin graft done, feeling very good on the left, and he's at the front of the cage, and he's got a normal facial expression. The one on the right, there's two things here. He's gone to the back of the cage, so a change in behavior, and you can see a very different facial expression in Max when he's not feeling comfortable. But again, with cats, a lot of people, think that that isn't so straightforward, and I would agree with that. So certainly when you sedate cats, they will have changes in their facial expressions, and when they're waking up from anesthesia and still sedate, we will see that. But again, if you have a team that looks at the cat before, during, and after the procedure, you'll start to see changes. And we're just going to look at a video of a cat from before the procedure all the way till after, and you will be able to pick up the changes in facial expression. And I think all of you that are watching this video can see that there's been quite a big change in his facial expression and how he's posturing. And this was a cat that had undergone major dental extractions, and he looks quite different now from before the procedure, after he was sedated. And clearly this is a cat that I would go and look at more carefully, and I certainly would intervene and treat this cat. So those are just some tips of things to look at, and you can certainly start using pain scoring tools in your practice. But if we put things together, we're going to look through some videos and see if you can pick up all the different pain behaviors that we've talked about in some of the upcoming videos. So this is a little kitty called Ernie that has actually had bladder stones removed, fairly major surgery. So start looking for all the things that would indicate that he's painful that we've already talked about. And if you were going through a checkbox and scoring him, he would actually receive a very high number for his pain. We've got him in lateral posture, his legs are extended, he doesn't want to put them down. It's difficult to see because he's a black and white cat, his face, but he's got squinted eyes. He's actually doing a little bit of writhing there, trying to get comfortable. And now we're going to palpate his incision here, and then we're going to see a close-up of how he reacts to that. And if you watch very carefully here, he flinches just as we touch him. So clearly not a comfortable cat at all. So all of these things put together tell you that you're dealing with a painful cat that needs rescued. And again, sometimes it's not always clear, and certainly the team and usually this is the technicians in the hospital, they see the cat come in, they get it ready for surgery, and they see the cat after. And they're often the ones that pick up the difference before and after. So we're going to look at a cat before and after ovarian hysterectomy. So this is a cat immediately post-op, back of the cage, head hung low. This is not personal hygiene, this is attention to the wound. And then I'm going in to check her. And quite hunched there, not very interactive with me, and actually is looking for somewhere to hide. So this is after she was spayed, a few hours after she was spayed, and then we're going in and assessing her her wound. And so the answer for this cat, until we actually put everything together, was she's licking at her wound, so we should put a e-collar on her. Well, that's not the answer. The answer was she was giving us plenty of indicators that she was painful. So actually we did go and treat her, then we came back and looked at her, and what you're going to see is the same cat after intervention. So she was not sitting in the corner hunched up, she was in lateral, curled up and relaxed. She is much, much happier about the fact that I'm visiting and checking her out. She's quite interactive with me. And so what I do is take her e-collar off and then watch her for a little while, and she does not go back and start licking her incision. So we did the right thing, and her behavior changed completely for the better. So once we look and start recognizing pain, we have to think about preventing and treating pain. So what are all the tools in our toolbox for doing that? Well, first of all, we have to understand the whole mechanism of pain. And when we do surgery or an animal undergoes trauma, for example, hit by car cases that come in, what happens at the site of injury, we have transduction. So we cause tissue damage, we have release of inflammatory mediators which sensitize nerve endings, and that information is relayed through the peripheral nervous system, and the information is relayed to the central nervous system, and that information comes in and relays into the dorsal horn of the spinal cord. When the animal wakes up, because obviously they're asleep while we're doing surgery, as soon as they wake up, then they're going to be aware of that pain if we don't do something to prevent this whole transduction, transmission, and awareness of pain. So after we're done surgery, we have to remember, just because the surgery is over, this primary or peripheral sensitization is not over, because now what we've created is a lot of inflammation, and that can be for variable periods of time. So the inflammation at the surgical site continues, and that continues to be transmitted to the dorsal horn of the spinal cord. And again, if we don't do something to stop the dorsal horn being bombarded with information coming in from the painful surgical site, what we get is central sensitization, or what some people like to term as rewiring of the central nervous system, and that is called central or secondary sensitization. And the key receptor that modulates that is the NMDA receptor in the dorsal horn. So we really want to prevent the information coming from the surgical site and arriving at the dorsal horn, or prevent it actually acting there. So certainly when we are thinking of pain management protocols, we're aiming at looking at what we can do to shut down this whole mechanism of primary or peripheral sensitization, transmission, and central sensitization. And we have a lot of tools that we can do that with very, very effectively. Another big question comes up, though: how long do we need to treat? And of course, most people's immediate reaction to that question is, well, as long as they're painful. But it would be good to have some guidelines about how long we should treat. And then remember, we're not always perfect at actually recognizing pain in cats as well. So if we just think about the importance of understanding the role of inflammation in creating pain, so I tried to make this very simple visual for you to understand that. So we do surgery and we have a lot of inflammation. So if we look at this top triangle going from left to right, over time, inflammation starts to decrease, and eventually it resolves and we have no pain. So if we choose not to treat an animal with any analgesics, then clearly the animal is painful through the acute phase, where we're doing the surgery, during the healing phase, until there is total resolution of that injury. And they're going to be a very unhappy cat for that entire time. If we look at the middle triangle going from left to right, this is what we're very, very good at doing, and we know that from the data that we talked about at the very beginning of the presentation. We're very good about giving very robust short-term analgesics, and that takes care of a few hours of surgery, and so the cat feels very, very good while we've been treating it. But if we withdraw our treatment plan, when there's still quite a lot of inflammation present, what happens is we get reinitiation of pain. The nerve endings get sensitized because inflammation is still there. So the cat feels very good while we're treating it, but after we withdraw treatment, it becomes painful until the wound or the trauma resolves. So what we need to do is look at treating these cats throughout the inflammatory phase until there's resolution of inflammation. Then we can withdraw our treatment and the cat will be happy throughout the entire process. One way to decrease inflammation, it's not just all about drugs, is to decrease surgical trauma. And we do know from data in animals and in humans, if we do smaller incisions, we cause less inflammation. So again, if you are gentle with your tissue handling and make smaller incisions, we're going to have less surgical trauma and less pain. But a lot of our ability to control pain is going to be based on the drugs that we use. And we do have a lot in our toolbox, and we're getting more and more as companies become much more interested in developing products specifically for cats. So we have opioids, we have non-steroidals, we have local anesthetics, and then we have NMDA antagonists. Those are the ones that target the central sensitization. And really the only drug that we probably know about right now in animals that very specifically targets that acutely would be ketamine. So what are the biggest players in our toolbox for treating acute pain in cats? Well, certainly, if we look at where the drugs act, the non-steroidals are going to decrease inflammatory pain. Certainly, we have inflammation to deal with. Local anesthetics can help prevent the transmission of pain. We can target the NMDA receptors, but then we have opioids, which actually work in several different places, and those are often thought of as the cornerstone of acute pain management. So certainly in veterinary medicine and in human medicine, we do know that opioids are highly effective analgesics. They have a very, very wide margin of safety, and they probably are the keystone or the cornerstone to our pain management in cats for acute surgical pain. So opioids, certainly the timing of administration is important, and we do know that if we give them prior to the procedure, there are a lot of benefits to doing that. So even if you have a short-acting opioid, this is data on the left, the graphs, this is a short-acting opioid given prior to surgery versus giving it after. So getting your opioid on board prior to surgery actually is much, much more effective than waiting till after the procedure to then give your opioid. So we always encourage preventive or preemptive use of opioids. The other benefit of giving your opioid prior to the procedure is it's anesthetic sparing, so it allows you to turn your vaporizer down so the cat will breathe better, have better blood pressure, and so on. And often they require less induction agents as well. So timing of administration is very important with opioids. And so putting that very simply, pain is much easier to prevent than it is to treat. But there are some side effects of opioids that I think we should discuss. One of them is that cats are very unique in the fact that they get mydriasis, they get these big dilated pupils after we give opioids, whereas most other species actually get constricted pupils. So that's one side effect that we're going to explore a little bit further. And then there are some opioids that can cause an elevation in their temperature, and usually you see this in the first few hours post-operatively. And any of the opioids can do that, but the one that is probably reported to do that most often is hydromorphone. But if we think about the mydriasis and how that could be a problem, if you just imagine you're the cat and this is your surgical team, before you get your opioid, this is what your surgical team looks like. But after you've had your opioid, which is going to be a very good idea to help you with pain, this is sort of how your surgical team looks, because they have the big dilated pupils, they can't focus very well. So I think you must remember that cats maybe don't see you coming. Their ability to judge depth is a little bit off after an opioid. So when you approach them, talk to them, move slowly. And the other thing is, if your eyes are fully dilated, make sure to keep the animal out of bright sunlight or bright recovery room lights. Just as we don't like coming out into bright sunlight after we've had our pupils dilated for our annual eye tests. So just think about those little things and you'll be very happy about using opioids in cats. Another thing is, historically, people have always talked about how some cats would get manic after opioids. Well, a lot of that data is based on drug dosages that really aren't clinically relevant. This is a cat who had an extremely painful eye before we gave her some opioids, and this cat is now very, very comfortable. She's very, very easy to handle, and she's actually euphoric, not dysphoric. So most cats at the doses that we recommend now of the opioids that are effective, they don't get manic. They actually get very, very euphoric, and often we're using them in combination with sedatives. So this really isn't an issue, but you'll see them rubbing, they'll make muffins with their front paws and roll around and become quite friendly in most cases. So which opioids should we be focusing on when we're treating pain in cats? Well, we have several groups of opioids. We have the agonists, antagonists, and really the only one in that category is butorphanol. But we do know that's a very, very short-acting opioid, probably an hour to 90 minutes duration of effect, and it probably isn't adequate for anything other than very, very minor pain. Then we have the agonists, and we have morphine, methadone, and hydromorphone in that group. And remember, none of them are approved for use in the cat. We're using these off-label. And then we have buprenorphine. And if you look at the literature, there's an awful lot of data on the use of buprenorphine in cats. This is a recent review of all the different papers that have been published using buprenorphine in the cat. It's a very, very effective drug. It's very, very popular, and it is approved for use in cats in many countries, and soon there will be an approved product in the United States as well. So buprenorphine, it's in a different category of opioids, and it's categorized as a partial agonist. But really, within the clinical range of the doses we use, it acts very much like a full agonist, even though it's categorized as a partial agonist. Very, very effective drug for a lot of different acute pain syndromes in cats. And then we also have the non-steroidals, and certainly those are very, very efficacious for surgical pain in cats. A lot of data out there showing that they're very effective, and they can last up to 18 hours after 18 or even longer after a single dose. So they're often incorporated into our protocol as well. Use of local anesthetics is something that we probably haven't utilized a lot in small animal practice, but we're certainly realizing the benefits of that currently, and using a lot more local anesthetics, certainly in feline and in canine procedures. So one of the commonest ones you probably use in feline practice is the digital nerve block if an onchiectomy is going to be performed, and I'm sure most of you are using that block for declaws. There was a paper that came out several years ago saying that there was no benefit to giving short-acting local anesthetic looking long-term and post-operatively. And if you think back to what we said about how long do you need to treat pain for, remember, if you're only giving a local anesthetic that lasts 3 to 4 hours, maybe 5 hours, remember that after a declaw, that's not how long the inflammation lasts. So the cat's feeling pretty good while the local anesthetic's on board, but when it wears off, you still have a lot of inflammation and reinitiation of the pain pathway and how the cat feels. And if you even look at how cats behave abnormally after a declaw surgery, certainly it's for several days, if not longer, not just a few hours. But this isn't to say we shouldn't be doing these nerve blocks, because certainly if you do these nerve blocks, it makes anesthesia a lot smoother, and it does give you additional analgesia in the acute recovery phase. But you are going to have other drugs on board to help the cat once the local anesthetic wears off. Other blocks that are very easy to do are things like the intratesticular blocks in tomcats, and certainly that stops the change in blood pressure and heart rate when you actually perform your castration. So very simple and very easy to do these blocks. But again, we've talked about individual drugs, and then one big question is, what about multimodal analgesia, like putting more than one drug into your protocol? And the way I think about this is, if you think of this poor guy on the left here, penalty kick about to happen, and it's just him, and he needs to try and block that ball. So if you're on your own, the chances are not as good as if you get a few of your buddies there and you make a wall to try and block that penalty kick. And that's a little bit how I think about multimodal analgesia. Can we block the pain pathway at more than one site? And yes, we can. So multimodal, which drugs would we put together? And we're not going to go through all of the drugs that could be combined in a protocol, but two of the commonest drugs that are combined are an opioid plus a non-steroidal. And certainly this is just one paper that shows the benefits of combining an opioid with a non-steroidal. This was a combination of buprenorphine with carprofen, which is labeled for use in some countries, certainly not in the United States. But certainly this showed you that when you combine these two groups of drugs, you had a beneficial effect. So certainly we have come a long way, and we still have some work to do helping cats with acute pain, but we can certainly, we know there's increased awareness that cats certainly hurt when they undergo surgery. I think we now have some good validated pain tools that I think if you incorporate those into your practice, you'll see how easy they are to use, and how we become very, very good at just knowing when a cat needs to be looked at and when intervention is required. There's a lot more scientific data now with evidence base of the benefits of preventing and treating pain in cats. And then the other thing that's really helping us is that we do have FDA-approved drugs for cats. So we are certainly able to treat cats very effectively for pain and remain on label with our treatment protocols. So if we go over what we've just talked about, we've got drugs that are certainly at our disposal. The timing of administration is important. We want to prevent pain before it even happens. We have to think carefully how long we want to treat and pain in cats. And remember, most pain is going to last more than a few hours. We should think about multimodal approaches and then keep assessing your cat. If you intervene, did the cat get better? And then again, always to remember that every cat is an individual, and so the same cat, the same protocol may not work for every cat that you deal with. Thank you.
That was fantastic. Thank you.
I don't know. I wasn't sure on timing because I know there might be a lot of questions. So I think we were right about just over 40 minutes, maybe.
Yeah, just about 40 minutes. That's what I had too. I think that'll make for a fantastic Q&A session. We'll have about 20 minutes for Q&A live there on the date of the event. So that is great.
Okay.